So if you've been trying to figure out what's the difference between chiropractors, this video is going to be for you. I'm Dr. Gregg Gerstin. I'm a chiropractor, and I've been practicing for the last 17 years. And what we're going to talk about today is some of the different types of chiropractors that you may be able to search or find out there. There are some chiropractors that would fit into kind of a traditional model of chiropractic you think of, that you go to and they primarily provide chiropractic adjustments. They may provide therapies as well as exercises. And these people are really great managing your pain and your crisis. So they may be good at developing a rehabilitation protocol for you, which is super important, especially if you've had an injury. Now there are others that wind up specifying in different techniques, and whether it's a technique that just uses the top of your neck or one that just uses the bottom of your low back, they all look at something specific, or one that looks at your entire spine. Now, what I've found is that the most common comparative is to a corrective chiropractor. Now, a corrective chiropractor is someone who winds up managing the crisis that you may be in using traditional chiropractic tools. But then they have an additional set of toolboxes that has been designed to do some really special things. And what I want to do today is talk with you about those special things that they can wind up doing with it, because I think, as you'll see through this video, corrective chiropractor is the right approach for you. Now, traditional chiropractic, like I said, is really outstanding in managing crisis, getting you out of the discomfort towards a place where you're comfortable. And the adjustments can wind up making noise. They may wind up not making noise. They can use a tool. They can use their hands. The goal for this is to wind up creating mobility and motion within the spinal segment so that it's closer to an ideal motion and function. Now, what I want to do is share with you one of the biggest differences that there is between a traditional chiropractor and a corrective chiropractor. So now, when you've been to a chiropractor, you're thinking of going to one of the key things that you should look for them to be winding up able to measure and monitor winds up being what are called outcome assessments and outcomes. So when people go in to see a chiropractor or a healthcare provider, they usually have something called subjective symptoms, problems that are going on that they'd like help and guidance from, and that's probably you. Those are really important, but what we found is that many times those subjective problems and symptoms will wind up going away. But there's still a problem going on, or things are still not in the normal position or normal place. So it's really important to understand what's causing the symptoms that you're having, because if we don't take care of the cause, then the symptoms will just keep coming back. And whether it's in a week, whether it's in a month, whether it's in a year, the problems when they come back are going to be more severe, cause more problems, take longer to heal then, and may not be able to correct. Here in our office, we use several outcome assessments that really are powerful. So one of the first ones that we use is a digital posture exam. That's where we actually use photo images to track your progress as you're under care and through life. A second one I'm standing in front of, and that's our X-ray unit. This is a tool that we use to measure and monitor for pathologies, traumas, to make sure that you're in the right place. If you have a broken bone, or if you wind up having a pathology, we're going to get you to the right place that you need to. You know, it's not too long ago, I had a patient come to our office after she fell while she was traveling. She went to the emergency room. She was in so much pain while she was gone. They took x-rays and CTs and said she'd be fine. She came home, and about 4 days later, she was still in miserable pain. She asked me to use my magic hands, and I shared with her, we got to figure out what's going on. As we went through our exam, we took some x-rays of her, and her cervical spine was actually dislocated, and it had been since she fell. Thank goodness we took these steps to make sure that she was safe. Now, she actually didn't get care here, and we rushed her right to the emergency room, because that is a life or death situation. So you want to be sure that your doctor is looking for those things. Once we rule out that you don't have something that's going to immediately kill you, thank goodness, then we'll wind up using these images to assess for posture and how close to normal positioning you are. Because if you're not in the normal position, your body is deprived of brain energy that is needed to allow you to function properly. Then he can wind up developing the appropriate care plan to wind up making your symptoms go away, but more importantly, to make the problems go away. And what's really cool is currently there have been 7 different dual-controlled placebo-blind trials that have shown that if we can remodel the spine, we can reconnect the nerves and wind up improving not only symptomatology, but nerve function. And not just during care, but over a 2-year period, and you can maintain it. Now that's pretty cool, and that's long-term success. And I know that's what you want. So make sure that the doctor you're looking for uses outcome assessments to measure and track progress and to find the cause of the problem so that you can wind up taking care of it for good. The next up, we're going to go over what that process may look like and what the tracking they're going to look at should be. In looking at the differences between a traditional chiropractor and a corrective chiropractor, tracking that progress that you're going to take and giving you a guide along the process with measurements in between is really important. One of the tools that a corrective chiropractor may use is a chart like the one right behind me. Now, this one was researched by a group called Chiropractic Biophysics Nonprofit. That's the process that we use, and they've done over 250 peer-reviewed articles on tracking spinal correction and making spinal correction and long-term progress over it. It's pretty amazing. What they found is that depending on what your spine looks like when you meet the practitioner will dictate how long it'll take to make a correction take place and if a correction can be made. The process that you go along will be outlined by this. So depending on what changes have already happened within your spine, and those changes can happen due to trauma, right? Like when you fall, or if you've been in a sport or a car crash, or if you roughhoused with your siblings recently or when you were young, if you fell or bumped your head on a corner of a table, or they can be from things that you do every day. You know, what happens is that, and it's why it's so important to look inside, is because it's like the walls in your house. You know, they can look beautiful from the outside. You can be a chiseled muscle man. However, when we look on the inside, if the structures don't look right, okay, and that will be like the muscle man is those clean, nice walls that nothing's been put in. If we got behind those walls, we might see that there are termites that have eaten away portions of the wall. And that's where these outcome assessments help us to understand. Has there been just a little nibbled on? Or have you been eaten away and are you losing the fight against gravity? These will dictate where you need to go, what you need to do. And your corrective chiropractor will help you on tracking this progress as you're moving along to wind up changing the things that need to be done to make that permanent correction take place. Tracking the process, super important in understanding where you are to where you're going. Now, this tracking may not cause you any symptoms, and you may resolve your symptoms and pain real early, but taking care of the cause of the problems helps you to live pain-free, active, and a full life for as long as you'd like. Now, there's one more thing that's a big differentiator between a corrective chiropractor and a traditional chiropractor, and I'm going to show you that in just a minute. When you're looking to find your chiropractor, there's a few things that you're going to work for. Right now, we're going to go over the process of tracking and necessarily how we wind up tracking it within our office. What I'm going to go ahead and do is share with you the screen that I'm on how we wind up tracking it. So what you'll wind up seeing is that this is a patient's image of their spine. They've given us permission to use this to share it and to help other people get healthy. And when we look at their spine, there should be a normal position of the neck. That's outlined in green. This patient's cervical curve is outlined in red. As you can see in the lower part of his neck, his spine goes through a reversal. This is part of the reason why he's had difficulty with neck stiffness and pain, lack of range of motion, numbness and tingling in his hands, and difficulty with sleep. Early on in care, we look to determine if and how much of a correction can be made. And we use the tool right here to place underneath their neck to determine that. This tool is called a Differential. It's got 4 different dual control trials that help us to understand the significance of how important it is. And what we can see is that there's a significant correction towards normal that is still available in this patient. So we're going to look to work and make a correction for him. When the patient follows their recommendation after a period of time, we wind up taking an update. And the update winds up being the same as the initial image of them from the side. And what we look to see is how much changes occur. When a patient follows the direction and does the work that we do, we can wind up seeing a change like this. You can see this picture was taken back in November, and then this one was taken in March. As you can see, the patient's second film is way more vertical. They don't quite have a curve that matches the ideal and normal, but if we were to look along the chart and path for this, this is going to take longer, and the patient knows that. We're going to continue to work on introducing that curve. However, they're much healthier this way. Actually, the patient no longer has numbness and tingling in their hands. Their neck isn't stiff, and they can sleep better, which are all awesome outcomes for the patient. The change that we wind up seeing on the x-rays is also awesome.
So when you're looking for a chiropractor, make sure that they're going to track your symptoms, but also make sure that they find the cause of the problem that they're working on and that they can change it. Because if they can't change it, then you're going to just wind up back where you were in several weeks or months. Now, if you've got questions about this, feel free to write them down in the comments below. If you like this, give it a thumbs up. If you've got questions or know someone who's searching for a chiropractor, forward this video along to them. Let's make sure that we share it. And if you like videos like this, make sure you hit the subscribe button so that you can wind up receiving our updates as we share them about health conditions, how you can manage them, when to get help, and what that should look like.
So we just went through some of the differences between a traditional chiropractor and a corrective chiropractor. Make sure as you're looking, look for what's going to match with what you want. For most people, they want to take care of a problem and make sure it doesn't wind up coming back. The way that you wind up doing that is by looking for that corrective chiropractor. Now, many chiropractors wind up being very helpful out there and can manage acute symptoms, but most of the time those symptoms wind up showing up for a reason. So finding the reason why, working with someone who can develop a plan to attack those reasons, use natural ways to wind up making sure you get back to the health that you want and that you need are super important. What I want for you to do actually is to check out this video. It's about one of our patients who tried a few other methods of chiropractic before meeting our practice and joining it, and the outcomes of what they've experienced. This is really powerful, and I think it'll help you to understand what the differences are between a traditional chiropractor and a corrective chiropractor. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.